Now, before the holidays, we told you about flu cases spiking, but now as we get further into the new year, some experts say there's a shift.
Yeah, a shift in the sniffles. THV 11's Brooke Buckner shows us what else doctors are detecting.
COVID is at the top of the list and flu has descended. So it's some good news, bad news.
Dr. Joel Tumlison with the Arkansas Department of Health tells me that's a big change from where we were a month ago.
Flu numbers have declined pretty significantly now, 4 weeks in a row. They're definitely heading downhill. They're still at fairly high levels, but it's no longer very high with large numbers of people getting sick.
Dr. Tumlison says hospitals are also seeing less flu but more COVID.
Last week, hospitalizations in Arkansas due to COVID were in the 400s, which for context is about at the same level it was this summer during the Omicron BA.5 surge.
He says the new Omicron subvariant XBB 1.5 has something to do with the increase.
It's a little more infectious.
And even though it's not currently the predominant strain here in Arkansas, he says it likely will be in the next 3 or 4 weeks.
As it currently is in the northeast of the United States, which seems to be where it started.
Over at UAMS, Dr. Raul Supal says he's also seeing an uptick in COVID hospital admissions. During this time of year when lots of people have runny noses or sore throats, he says it's hard to know if you're contagious or not, so be extra cautious.
That doesn't necessarily mean you need to stay out of, larger public settings. If you can, you should. And if you do, please wear a mask and make sure that you follow your symptoms. Talk to your doctor. They can provide advice.
In Little Rock, Brooke Buckner, THV 11 News.
A reminder, there are boosters available designed to protect you from the latest variants.
And both doctors still point to COVID vaccination as an effective way to avoid getting severely ill from the virus.